I'm sure you were aware, I hope you were aware, that we have a major crisis in being able to recruit and retain teachers, nurses, other allied health professionals, people in the mental health area, and many other key areas, construction and so on. And at the back of all of this, as the reports are coming out and making clear, if it wasn't already clear, is the lack of affordable housing for people, particularly in areas like Dublin and the epicentres of the housing crisis. So what I want to ask is, what are you doing from a public expenditure point of view to address this recruitment crisis and the housing crisis that lies behind it?
Thanks very much, Deputy Boyd Barrett. The level of employment in Ireland reached over 2.55 million people in the second quarter of this year, which is the highest level ever. Increased labour force participation has been an important factor behind the strong employment recovery. Despite some expected softening in the labour market over the next year or so, tight conditions and skill shortages for some sectors are likely to persist in the labour market. This creates challenges for all employers, including the civil service and wider public service. However, it is important to point out that notwithstanding these challenges, the public service has continued to grow its staff numbers very significantly. Between 2015 and 2021, for example, overall serving numbers in full-time equivalent terms increased from about 302,000 to 366,000. So that's an increase of 64,000, or over 20%. Over 2022 alone, the numbers employed are estimated to increase by almost 15,000, or 4%. Pay in the public service has been governed by a system of collective agreements since the Croke Park Agreement negotiated in 2010, and you're well familiar with the background to all of that. And in earlier replies, I have put on the record where we stand in relation to extending the Building Momentum pay deal, which, if approved, will result in further significant increases in pay of 6.5% between now and the end of next year, with 3% of that backdated to the 2nd of February this year. I understand that the Public Services Committee of ICTU will convene later this week to aggregate the ballots of the different results that have been brought forward by the unions. We already have had two teaching unions have confirmed that they have ratified the deal, for example. So I think that will certainly help in terms of recruitment in the public service. But there is an issue not just in the public service, Deputy. We all know across a whole range of sectors attracting labour is a challenge, including in the private sector. But I would point to those overall numbers. In fact, I saw a report the other day in the department that the number of staff at the end of Q2 had reached 370,000, and in Budget 2023 we've provided funding across the public service to increase that further to over 390,000 by the end of next year, and that's coming from a base of 302,000 just back in 2015. So we've had a very, very significant expansion of the public service, but I acknowledge there are challenges across a whole range of areas.
There are a hell of a lot more than challenges, right? You've got one nurse to 14 patients and wards in St Vincent's Hospital. We have massive shortages of staff across the healthcare system, mental health, SNAs, teachers leaving Dublin. You've seen the reports because they can't afford to live here. Okay, now, so all this reeling off the statistics about public sector recruitment just won't cut it. It may be fact, but it doesn't explain why we've got massive staff shortages across our health service and therefore massive waiting lists, a crisis in our EDs, and we have classes being cancelled because teachers have nowhere to live. Right? Now, what are we going to do about that? Now, I've got a proposal. I heard you say we shouldn't spend the windfall tax receipts on ongoing expenditure. Exactly right. So why don't we invest it in buying up and acquiring more housing property, okay, instead of letting the big investment funds buy it up and charge extortionate rents that teachers and nurses and construction workers can't afford. That would be a sensible investment of that money, wouldn't it?
Minister.
Deputy, as you well know, the government, through the local authorities, the approved housing bodies, the LDA, is embarking on the largest public house building programme that this state has seen, and rightly so, because you are correct in outlining the scale of the challenge that's there, most acute in Dublin, but it's present elsewhere around the country as well. But because of the very reasons that you raised there, that's why the government did bring in a cost of living budget. That's why we are reducing childcare costs by a quarter next year, why we're continuing for another year with the 20% reduction in public transport fares, 50% for young people. That's why we are eliminating inpatient hospital charges across the healthcare system. That's why we're reducing education costs at primary level, at third level, increasing SUSI grants. You're right, a lot of it does come back to housing, it does come back to accommodation, and that is why we are focused on delivering on that house building programme. You make a particular suggestion about the state stepping in to buy what? Completed developments, by individual units. You might wish to elaborate on that.
I do, yeah, okay. I invite you to drive along the N11 towards Cherrywood and down to Shankill with me, okay? At the end of the road, you'll find the LDA site, which is their first site, by the way, and there won't be any houses there for another 2 years. But before you get there, you'll see a lot of big apartment developments which are near completion or have just been completed. Now, who's going to own them and who's going to live in them? At the moment, international investment funds will own them, and they will rent them at €2,500 to €3,000 a month, which none of the workers in St Vincent's Hospital or the school teachers who are leaving Dublin can afford. If the state used the money they had in the rainy day fund to buy them and then designate some for affordable and some for social, those teachers, those nurses, those construction workers who need to work in Dublin and live in Dublin could afford to do so. Now, wouldn't that be better expenditure than, in the end, probably paying huge amounts in RAS, HAPs and leasing, ongoing current expenditure, rather than a direct investment now to house people?
Thanks very much, Keir. Look, Project Tusig of the LDA is going to do a lot of what you suggest, Deputy Boyd Barrett. And in fact, the government recently discussed the situation that is now developing, where we have a significant number of sites that are earmarked for build-to-rent apartments, where the private sector now is unlikely to proceed with those developments because of the changes in the interest rate environment. They can now look elsewhere for returns in non-property. They can buy government bonds and so on. And that model is probably now less attractive than it was 6 or 12 months ago. And the LDA is positioned, is capitalised, has the resources to step in and actually purchase and then develop out those particular schemes. I think there is potential there. I agree with you that we want to have a reduced dependence on current expenditure, rental supports, and an increased emphasis on capital expenditure, building permanent homes. That is what we want to do.